Hello, good evening, and this is another installment of Conversations with Gigi, and it's presented by the Pennsylvania Avenue Baptist Church, and I'm your moderator, Reverend Dr. Kendrick Curry, and I'm just excited for our discussion this evening. We have Dr. Gigi here, and we will discuss updates on COVID-19 in the DC area. So you don't want to miss this. This is a grand opportunity to have us gain some understanding, some insight about the latest developments that are happening on the medical scene with regard to COVID-19. So without any further ado, Dr. Gigi, how are you doing and how are we doing with regard to COVID?
Well, I'm doing fine, but probably like everybody else, I've got my moments. I mean, this has been really rough being in quarantine. I'm not gonna lie. It's a lot. Work has a very different flavor. Not being able to see my friends or hug my family or go out, and I just felt like an ice cream cone the other day, just walking to get an ice cream cone, and that kind of stuff. I still am very thankful. I'm very thankful. The families, thank God, good, and we have a place, homes to stay in, food to eat.
Yeah,
But it's kind of wearing on the nerves, I have to say. So yeah, I'm here to tell you the latest update. I'm at the Rodham Institute, which is at the GW School of Medicine and Health Sciences. And the Rodham Institute is dedicated to improving health equity in Washington, D.C. So the COVID numbers continue to go up in Washington, D.C. They are leveling off in some hospitals. For example, at GW, our numbers are leveling off. They're slightly increased at at the United Medical Center.
okay.
Nothing new to report really in terms of treatments. We do know the things that still work are the masks, right? As well as the hand washing, forearm washing, face washing, especially when you come from outside. We know that sleep matters to protect your immune system. We know that physical distancing, not social distancing, physical distancing of at least 6 feet is going to be key. I think the real challenge right now is how are we going to sort of move forward? As you know, I'm on the Reopen DC task force that the mayor created, and I believe that she has laid out a very smart plan. That's a phased plan of how to reopen. However, that what looks good on paper may not be good in in reality, because we're human beings. We want to get back to our lives, and we don't know what's going to happen in terms of the numbers. Will they go back up again? Will we have to scale back? We don't know. So officially, tomorrow is the first phase of reopening now. So, for example, dentist offices, I just got a note from my dentist saying, okay, we want you back. We want you to schedule your appointment. I think it's going to remain to be seen how this is going to impact, people, especially in Southeast, because still the majority of deaths have happened in African American communities. And we know this because, and it's not a surprise, because of the social determinants of health, right? So if there is not the same quality of food or the same quality of air or water or education or economic development in a particular community, it's no surprise that the health outcomes would be worse. So COVID is just sort of the latest illustration. In terms of the treatments, really, again, nothing new. The hydroxychloroquine finally, by yet another research study, it absolutely does not work and actually kills people. So that's definitely off. So it was interesting to see that the president had taken it for 2 weeks. No comment. The remdesivir, which is available only in the hospital, is really for people who start to show those signs of inflammation. Those are the people that can actually have the complications. But remember, 80 to 90% of people do just fine with the infection, have very, very mild symptoms. It is the group of people who have sort of the they are more men, more people with high blood pressure, more people with conditions such as diabetes or heart disease, people who are heavier, and other sort of immune compromised diseases in which they're on steroids, for example, for lupus or rheumatoid arthritis. And of course, our elderly. Those are the vulnerable people that tend to have more of the complications from COVID. But I would say that over the last several months, we've learned a lot. And as a result, it's not that there's really a huge cure or anything. I think we've been able to recognize who needs more uh, specialized and intense kind of attention and what not to do. Uh, you've heard a lot about an immunization, and Fauci said, well, maybe there's something at the beginning of 2021, and there are some trials that are happening right now to test vaccines in healthy adults. But remember, when you are a healthy adult, you're going to have a good antibody response. Older people, when they get an immunization, they don't tend to mount the same antibody response, so they don't tend to be as protected as with vaccine. So let me say that a different way. When we get vaccinated against, let's say, the flu, if you are younger and healthier, you're going to be more protected because your body is able to create those antibodies that will protect you from the virus. But when you're older, your ability to have that antibody response as a result of getting the vaccine is just not as robust. So that remains to be seen. We'll see what kind of an impact it has. Even if it has a small impact, we'll take it. And lots of different medications are being looked at. The antibody test to see if people have actually had the infection or not, because remember, many people have been asymptomatic. They have absolutely no symptoms, and yet they've had the virus. The testing quality right now, the quality of the test is not really that good. I've had many of my patients ask me. I said, well, I can order it for you, but there's a very high number of people that it will say that they've been protected when they really have it, false positive and false negative. So I would say stay tuned. And then finally, I would just say that if you have any of those pre-existing conditions, such as diabetes, such as high blood pressure, that put you at greater risk for complications from COVID, don't forget that if you can control your blood pressure, control your diabetes, that complication rate really goes down. So it's important to communicate with your clinician, to take your medications, to do everything that you can. And that includes sleeping well, eating as much in the way of fruits and vegetables as you can, trying to minimize stress, and that's one of the things that I asked Dr. Reverend Curry if we could talk about a little bit, because with all the recent events in the news, I don't know about you, but it's been very, very tough to see people just because of the color of their skin getting killed while sitting in their car, getting killed when bird watching, getting killed when going home to sleep after working as an EMT. So that kind of trauma, along with COVID deaths and all of the insults that keep getting hurled at communities of color, but specifically African American communities, is just sort of layer upon layer upon layer of stress. So that's my update, Dr. Reverend Curry.
Without question, Gigi, this is
Are you there?
yeah, I'm here. Without
Yeah.
question, this is a
Yeah.
traumatic time. And one of the practices of trauma stewardship is going to be very key. I think throughout all of the sessions we've had various folk talk about everything from meditation and mindfulness to yoga to other things that are de-stressing. And I really think that we need during this season to have some spiritual care as well. that which is reading, and in our tradition, reading scripture, reading the Bible is very, very important in terms of building your faith, building your confidence in God, and being able to help process that. But it's also something that we need to do to look at how do we begin to do better with this trauma? How do we do better with our processing? And I think it's going to be particularly important that we began to pay attention to what's happening in society once we reopen. I just happened to share at a funeral today, and I know it's very difficult during that time to socially distance or physically distance, but it's a different way of us communing together. So one of the things that I'd like to hear from you is if you could just say a word more about uh, ongoing mental health challenges. We are operating at lower levels of stress, and and those tend to escalate. How do we become non-anxious presences in amid this COVID virus? How do we lower anxiety and deal with depression? I think mindfulness works, prayer works for me. I think um, meditative walks and labyrinth walks and all sorts of other things are very, very important. Getting your steps in and doing those sorts of things while listening to positive reinforcement. But from a clinical standpoint, how can we begin to get the folk the help that they need? I know we've had urban playology and other sorts of groups on, but I'd like to hear anything else that you'd like to share on that.
Yeah. Well, I think part of this is philosophy,
Sure.
and it comes from various faith traditions or cultural traditions. I'll just tell you what works for me and what I share with my patients and what I found helpful for them, as well as myself and my family and friends. I think that in a time of extreme duress, it's important that we have look at the long game.
Yeah.
And if we look at the long game, we realize that this too shall pass. That for some of us of a certain age, we've seen bad things happen, and we thought that daylight would never come, and it did. And so that's an important perspective. If you ever look at any of the people who have had a long and happy life, and you ask them about what is their secret, I remember asking this to one of my patients, Ms. Hattie. She lived to be 105, and it was her 80-something-year-old son that would come and bring her in, and he was old himself, and he was bringing his mom. And I would ask her, what was the secret to your happy and long life? She said, I sing. But I think that the philosophy that you have, the philosophy that the bad things will happen, that's part of life, but there's also going to be good things, and the bad things hopefully will pass quickly. And to look at what it was that got you through those bad things, to remind yourself that here we're going through this, we've been through this before, we're able to get through it. So philosophy, I think, is very important. I would say the second aspect of that philosophy is gratitude. So just as I told you at the very beginning, I'm having a hard time, but I'm thankful for what I do have.
Yeah.
My family's healthy, I have food on the table, all of these things. And I remember when I was going through my breast cancer, illness, and I was getting my chemo and everything like that. And, I'm Muslim. So my mother would say, just say, thank God, alhamdulillah. And, for us, we say thank God even when bad things happen, because it is thank God. I was there. I got doctors that were able to treat me, and nurses that just took care of me, and medication that was available. So again, that goes to that philosophy. And then I have this ability, and I think it's important for us to just unplug. The last several days, I have not watched that video, because I know myself. I know how upset I would be. And, for good or for bad, my personality is such that sometimes I can even feel. I mean, imagine, especially as a human being, but as a physician, knowing that that person's knee is on somebody's neck and what is actually physically going on.
Yeah.
For me, I decided that was too much. That was just too much. I know I can read about it, but I'm not going to watch it. And I have to protect myself. So that's sort of number 3. Knowing when, if you are in that very vulnerable part, to protect yourself. So I always share this image with my patients. When we're in good shape, right? It's like we have a buffer around us. When we have gone through stress after stress after stress, that well is
Sure.
very, very dry. It's like the outer core, that shell has been stripped away. And all that's left is this very vulnerable core. So we're not going to, throw things at that core. We're going to try to protect that core until such time where we can build that buffer back up. So protecting that core means I'm not going to watch, I'm certainly not going to go on social media. Not that I have, I don't have Facebook or any of that. I'm definitely not going to watch things on TV. I'm going to read. And then even, for relaxation, I will not watch difficult movies. I just will
Sure.
tend to
Sure.
watch comedy.
Yeah.
I believe that nature, actually, after this webinar, my brother's going to come over and we're going to walk outside with the dog. I think that nature is healing. And there are lots of studies and research that shows that being outside, and even if you're not outside, if you realize if you have a painting of a body of water, like an ocean or a lake,
Yeah.
that's healing. So I think it's, but I'm not going to put myself out there as a perfect person. I mean, since last week's webinar, I had my moment. I had my little crying spell. I mean, it's hard. And for me, the thing that makes me cry is to see needless suffering.
Yeah. Yeah. Yeah.
And
Without
I'm going to start crying. I'm going to start crying now, Reverend Curry, because I mean, this last little bit is just, it just breaks my heart.
it's okay. Crying is one of those things that we don't talk about enough, but there is a certain chemistry of tears to release all of the various toxins and what have you into, so that it's relieving. And so we encourage folk to actually cry and make sure that in your crying, you let yourself go. And we will say weeping endures for a night, but joy comes in the morning, and
Right.
which means that it's temporary. And so
That's right.
I definitely appreciate what you just said. And also, I in our faith tradition, as we deal with this whole COVID experience, it really is about contending with this whole notion of being thankful, or having a heart of gratitude.
Yes.
In the faith tradition, in the Christian faith tradition, that James is one of the writers of Scripture, and he says, "Count it all joy," and that is a very puzzling text that encourages us, despite the circumstances, to really
Yes.
look for all that is good, all that is wholesome, all that is fresh, all that is brand new, all that transforms, all that really is enabling and augmenting and helping, but to count it joy. And so looking for the joy in these moments are very good. It is the joy that you can have of even walking the dog with your brother and experiencing those moments, or the joy that you have in watching a comedy, or the joy that you have in just being around family and learning to explore new things. And so I'm
Right.
just indeed grateful for your sharing with regard to that. And I just hope that as we see more people, that we learn that of ways of finding physical distancing, but finding joy in just seeing one another and being present with one another in these times. So I thank you for sharing that. I do want to
Yes.
ask you, with the
Sure.
reopening, um, do you really think that is something that's perhaps a little too premature, that we don't know enough, or are we just looking at something and saying, "Oh, we shouldn't really pay attention to this whole COVID thing"? maybe we should just go and re-engage and do what we need to do. Are we operating out of wisdom, or are we operating out of fear? With regard to wisdom would say, yes, be a little cautious. And fear may also say, let's be a little cautious, but for the wrong reason. Or are we looking at a situation where we're just overreacting?
Right.
How do you see this right now? Because
Yeah.
DC
So
presumably
great
will reopen
question.
soon, just like
Yeah,
some
great
other
question.
jurisdictions.
Yes. Yes. So great question. I can tell you that in the recommendation of the task force, which I believe the mayor is actually following, it's based on CDC guidelines that there have to be certain uh,
Sure.
metrics that have to be met before you can open, in terms of the number of cases, where they are, different parts of the city, et cetera. I think that it's not an exact science, right? Because we don't know. We've never had COVID before. But at least there is something that the
Right.
mayor is following.
Right.
It's not like in other states where it's like, well, we've had enough, and the economy is whatever. And the thing that bothers me about those kinds of discussions is that, for heaven's sakes, people who are coming from poor or under-resourced communities know firsthand what having a poor economy does to their health, right? These are not separated, these are both together. But to reopen the city in such a way which is smart and minimizes the risk to anybody and everybody. So I think what she has done is saying, okay, these are the guidelines we're going to follow in terms of reopening. But if anything spikes, then we're going to pull back again. And that's all we can do. You have to have ongoing monitoring. You have to be in touch and have on the ground community, tracers, and really, put the resources in place to do the testing and to monitor people when they do get sick, and to be very cautious in the reopening. And I like the way that it's being done in phases, not everything all at once. But
Yeah.
as we know,
Without
something
question.
can look good on paper, and then but I
Yeah.
actually have a question for
The phased
you, Dr.
approach seems
Reverend
to be
Curry,
good.
because yes, I wanted to ask you, because obviously as a leader and a visionary, really, in terms of what you feel your church and your congregation can do and is doing for the community, has the COVID crisis changed or impacted your vision? And can you talk more about that vision?
Sure. I definitely don't mind doing that. And I see, go ahead and put your questions. Those of you in the audience, feel free, because we do have time with Dr. Gigi to get some of these questions. In terms of the overall vision, I don't think the vision has changed. I think, the vision that we really have for the Pennsylvania Avenue Baptist Church is really to begin to look at what one might call a one-stop shop. It's a place where you live, play, work, and worship. And it takes on the model that you would find if you were to go to Jerusalem or some of the other, where the central part of town is really where you begin to have all of your holy sites, and then around those areas where the shops are and other places, you would begin to look at all sorts of shops and of living quarters and what have you. So what we're trying to do is look at both senior as well as market rate living, all that's reasonable and affordable, and putting in the necessary wraparound services that allow somebody to live, play, work, and worship. So you will be able to go from an apartment or come from your senior living facility. You can go to the church or visit the cafe, or you would be able to begin to share with others in and around the sitting areas, the meditation gardens, or working out at the gym, or being part of a group that has some connectivity of affinity groups that allows them to travel together and to experience various sorts of things. So this becomes a space and a place where you have have opportunity to just come together. It's a place where everybody wants to go. It's a destination. It's a place where everybody finds themselves valued and they have a sense of worth and dignity and they build community. I think that's very going to be very key. One of the things we've missed throughout this whole thing, we can build great buildings, but that doesn't mean that we're building community. Building community takes an understanding of how to become present, just like you and I are present right now, even in this webinar. And we have to begin to move forward and go with that. So as we look at the vision, of course, I see you and GW and all of those participating, perhaps even having medical centers there and having the services in the facilities where you need them. And so you address the emotional needs, the spiritual needs, the physical needs, so that somebody is always healthy. And we're building community because we care. We're building community because we have common interests, and we're seeking to be that which holds people together because of those common interests and common ideals and shared values that are talked a lot about in this particular city. So that's just a high level overview. And of course, I could talk about more, but I do thank you for raising the question. But I wanted to go back and ask you a question based on something that you've said and alluded to. You talked about testing and you talked about contact tracing, and I wanted to have you address both. One question that we have is so many people are anxious about testing. And so you're tested, then what? Tomorrow, next week, how do you hold this? So what do you do with the information once you're tested? You quarantine if you find yourself positive. If you're not positive, then what do you do? I mean, what good is it? Help us with the testing, and then we'll come back.
Well, I don't know if I will add any clarity, because part of the issue is that we don't have answers. And that's been the frustrating thing for the public, but also for those of us that are sort of clinicians or working in the public health sphere. So yes, you're right. When you get a negative test today, it only tells you about today. It doesn't tell you if you get exposed to somebody tomorrow or next week, if you won't become positive. So, I mean, like, for example, the president gets tested every day. I mean, ideally, that's what you would want, right? To know when you became positive, right? And we don't have that kind of capacity. What will probably happen is that people will get tested, like restaurant workers, for example, because GW has been asked to do testing of restaurant workers, probably in like every week or two, that kind of an increment. Now, not everybody requires that kind of testing. They're obviously outwardly facing, they'll be dealing with the public. It's important that they know what their status is so that if they become positive, they get quarantined. I think that's one of the things that we're still learning.
Okay.
What we do know about contact tracing, though, which I think has been something that's really not gotten a lot of attention in the United States. But if you look at countries where they have kept the numbers down, that is a key strategy that really prevented the numbers of deaths from going into the thousands.
Yeah.
So I believe it was Greece that has only had a few hundred. So the idea behind a contact tracing is, if let's say if I had COVID and I went to buy groceries, and then I went and filled up my car with a tank of gas, and then I went and did my laundry, that the contact tracer would just go through my day and find out, where did I go, who did I see. I mean, and they get very, very specific information, so they can trace all the people that I've had contact with. They put them in quarantine, they test them, so that circle doesn't keep getting wider. So effective public health strategies are that. So the other thing that's part of the Reopen DC is to try to hire contact tracers from the community, which is key. Because I don't know about you, but if somebody knocked on my door and asked to talk to me, and I didn't know who they were, I'm not going to answer the door.
Well,
And
absolutely.
and so if
Absolutely.
this strategy, this public health strategy is going to be effective, we have to have people who are from the neighborhoods, from the communities, and people who really know that there are some people that live, let's say, in a community, they don't know anybody. But then you've got that one person that usually knows, oh, that person was late coming home, or this one is on vacation. That one person that really knows the community, that would be an excellent person to do the contact tracing. So I think that's, I hope I've
Yeah,
explained
I
that
think you
well.
hit the nail on the head. Yeah, I think you hit the nail on the head with regard to that.
Mhm.
If you're positive, if you find yourself positive, then the best is probably quarantine, unless you're older and you have some pre-existing conditions.
Right.
If you're if you're negative, you know,
That's right.
hopefully you can still wash your hands, wash your
Mhm.
face, make sure that you wear gloves when necessary, make sure that you're physically distancing, and let your natural body sort of keep fighting. With regard to this contact tracing, it's
Yep.
culturally in Black and Brown communities, and I'm sure in others, that many folk are very hesitant with regard to sharing, well, who you talk to, where you been,
Mhm.
what have you been doing, and that whole level of trust, contact tracing, is really seems to be based on trust,
Yes.
and
Yes.
it's getting into a personal level
Well,
much
absolutely.
more
And we
than the typical American gets in anybody else's business. And so how do we deal with that? Because I believe in it,
right, that's
especially
right. And
since
and
the numbers I've seen, 81% of those African
yes.
American males, in particular, mostly male, are passing away, and all of African Americans are Black, are passing away, and as a result of this, because we're not talking, we're not tested, and we don't know, something has to change. But that's a hard way, because I can understand both sides. Tuskegee is still real in the life
Yes.
of many. The
Well,
Tuskegee study and the whole syphilis, and I can name others, but that's a real deal. So when you ask me about my business, I have a lack of trust. So how do I begin to feel trust? I hire folk from the community. What else can be done?
I mean, I
Anything,
think
Gigi?
that what
What
we're
else
doing
can be
right
done?
now is just to look. Yes, I
Okay.
think that what we can do now is what we're doing right now, which is education, right? I think it is having those open and
Right.
honest
Good.
conversations to say, look, it's not just Tuskegee, it's not just all these trials, it's the ongoing legacy of racism and classism that makes there to be distrust. How are you going to use my information? We know how it's being used. We know
Yeah.
that that you're not even safe in your home. For heaven's sakes, that young woman that came home, she is an EMT going to nursing school, and that gets shot and killed. So that's the framework that we're
Right.
in. And so for me to say, oh, but just this is something important, forget about, that is naive, and actually it's disrespectful. And I say disrespectful because it does not honor the lived experience of what people are, and to really honor their concerns, their very legitimate fears. So I think when it comes to these initiatives such as contact tracing, it must come from the community by definition. And it must be people such as yourself who are community leaders to do the education. Same with the census. I mean, the census is another very similar issue, which is happening now. And unfortunately, because of COVID, probably there's going to be a significant undercounting of Black and Brown communities, which means that there's going to be less funding. So, but these are the kinds of things that I think
Yes.
the
Yes.
healthcare system does not recognize, and they want to kind of reduce it to say, oh, people are just not educated. No, people are educated just fine. But because of what has happened and continues to happen, there is that distrust. So that's why I feel so strongly that when it
Definitely.
comes to clinicians, people in the public health sphere, we need to have Black and brown clinicians because it makes a difference, right? Because we're going to be more likely to
Yeah.
trust somebody who at least has the same awareness, if not lived experience. So that becomes very important.
Well, in that regard, I had a couple of questions. One, I know a few years ago, I used to just watch the numbers with regard to the applications, even for medical school, and it was down for Black and brown persons, male and
Yes.
female. Overall numbers were down. Are we seeing upticks to get those physicians? And then, if we do get them, what are the incentives that they should even go and do community-based interventions in medicine?
Right. Great question. So when I was at University of Michigan in medical school, I graduated in 1985.
Go blue.
We had 160 medical students. I know, go blue. 160 medical students in our class. 30 of us were Black and brown. 30. You would never have those numbers, and the majority were men. So I've got colleagues, Black male colleagues that are orthopedists, cardiologists, ENT, family medicine, psychiatry. That's just from my class. Now the numbers in terms of Black males, I want to say is maybe 3 to 4%. It's very, very low. And so one of the things that we at Rodham feel very strongly about, everybody's competing over those same Black males. Instead of throwing the net much, much wider, if you notice when you're trying to get kids to go into the healthcare field, at least, I'll just talk about healthcare, people are only tagging the gifted and talented. Now we know that
Sure.
there are lots of gifted and talented kids that may not have the grades. So for example, our programs are actually not intended for the high achievers because everybody's going to be competing over them anyway. We want to bring along the kids that may not have the A's and the B's. Maybe it's more the B's and the C's and even the C's and the D's, and bring them along and really increase the overall pipeline to bring in more kids. We do know this though, that when you have more African American and Latino physicians, I'm just talking about physicians, and this comes from the National Medical Association study in, I want to say, November of 2011, 75% of those physicians will work in Black and brown communities.
Wow.
75% of those physicians will take Medicare and Medicaid. So it
Right.
does make a difference. We know that when there are Black male physicians, Black male health improves. That's studied.
Absolutely.
It's been reproduced over and over again. So it makes a difference. I think that let's just get them into the schools, and not just medicine. I mean, we need nurses, we need social workers, we need techs, we need everybody in the healthcare system that to be as diversified. And I should also say, sometimes in these discussions, we're just talking about ethnicity or race. There's something else. Do you realize that when you have nurses at the table on leadership, patient care improves?
Absolutely.
So interprofessionalism, it's not just because people talk about doctors, heroes. Really, the real heroes are the nurses. Those are the real people that take care of patients. And they are the real advocates of patients, are the nurses.
Yeah, I totally agree with you, and I couldn't even express that any better, because that's key. Nurses are so valuable, and we need to make sure that we have them. And I really want to see many more of our young Black girls, our young brown girls, and others, and males as well, go into the field of nursing, and go into all fields. And perhaps that's something we can talk about another day, because I want to be a part of that educational process that prepares them,
Sure.
because we are dealing with the next generation. I believe personally that everyone, and I believe it's biblical, we should look at 3 to 5 generations ahead. So I'm not living for my children, I'm living for my
Absolutely.
children's children. and my children's children's children, what type of world will we have for them? So I'm pleased with what you are really saying, and I can resonate with that. I do want to know, with regard to this COVID-19, what are we going to do when the second wave comes? And if we have a second wave, are we immune if we've been through the first wave and made it and
Yeah.
survived it?
So again, great questions. Not exactly sure, but we think that if you've had it, you're probably immune, just like if you've had other infections. Not 100% sure, but that's probably true. But before we talk about the second wave of COVID infections, let me talk to you about something that's really troubling to me. And that is because of the fear of contracting COVID, people are not going in to get checked out for chest pain or stroke-like symptoms. The other day, I had 3 of my patients in the emergency department all at once, one with a stroke, one with a heart attack, and one who was having some mental health challenges. And all 3 of them had delayed coming to the hospital because they were afraid of getting COVID. So yes, we should focus on COVID, but that doesn't mean that we should take our eyes off all the other chronic conditions that are happening,
Absolutely.
right? Because
Absolutely.
I just had a lady who I had a telemedicine visit with, and she was complaining about her neck pain. And just as we were about to finish, she said, "And oh, by the way, I've been having some breast pain." I'm like, "What?" And it actually turned out that she had breast cancer and just had her
Wow.
surgery. She did well. So I think that we have to continue to have a holistic vision of these illnesses to try to minimize, obviously, COVID deaths, but and how it's going to be in the second wave. Well, maybe we'll be smarter and we can enact the quarantine in a much earlier phase to say, oh, there's an outbreak of COVID in Northeast, or there's an outbreak of COVID in nursing home X. Let's just close things down, do the contact tracing, and just be very focused on that. So I think what
Okay.
you'll probably see in the second wave is a much more sort of targeted, directed, focused intervention on whatever community there may be an outbreak in. But we're all learning as we go.
Yeah,
I'm
and
sure you've
that's the thing.
probably never, I was going to say, you've probably never heard a doctor say, I don't know, so many times.
But that's okay. That says that you're human. That says that
Yeah,
you're
hey,
human right
that's
there.
okay. I
Because
have no, I have no,
there's only one I know that knows it all, and
yeah,
and,
I,
and for me
I
that's God. So
yeah.
I do want to ask you. There's a question from the audience, and it came through, I guess, from Facebook land, and it says everyone does not have access to masks. Will the city have locations available to provide free masks for underprivileged families?
So I'm very happy to tell you that Miss Christina Williams from the Rodham Institute has been working with
Wow.
people who've donated sheets, and has I think we're about to be finishing distributing something like 1,500 masks. So there's all kinds of public-private partnerships. So if that person in Facebook land wants to just tell us where they are, and we'll try to get some masks out to you, because
That's
she's
good.
been really good at distributing the masks wherever there is a need, including, by the way, correctional facilities. I
Mhm.
will tell you that one of our partners, Cut 50, which is the organization that Van
Yeah,
Jones established, to work with reducing incarcerations by 50%, they are doing distributions as well.
good,
So
good.
that's another partner that we can bring in.
Well, that's fabulous. There's information around the city for those that will need masks. Um, our contact information is right on our Facebook page. You can reach us at Pennsylvania Avenue Baptist Church, 3000 Pennsylvania Avenue Southeast, Washington, D.C., 20020. Email us at pabcdc@msn.com, pabcdc@msn.com. The phone number is also listed, but Gigi, make sure you give them your information where is the best place to contact you?
Sure. If you just go to the Rodham Institute, Rodham Institute, there are lists of resources on our COVID page that you can go to. And actually, we've got an email address as well. So all the and if you can't get to us for whatever reason, I can't imagine why. If you get to Pennsylvania Avenue Baptist Church, we work together. So you can consider us one.
Well, and that's right. And we're finalizing our Facebook page, and it will have a partners page. And that partners page will
Great.
have all of the connections and the things that we really need, because we want to be a resource. That's one of the reasons we do this Hot Topic Thursday. Pennsylvania Avenue presents Conversations with Dr. Gigi, because it's just that important.
Yes.
It's that important, so that we'll be able to reach out further and deeper into the community. So we want to be able to tell your friends and tell all of those about the things that are going on. And if you're interested, we will be doing more of these different types of webinars and asking questions, because this it ain't over yet. We
Oh,
still need.
no.
Don't think that because we're trying to reopen that it's over. We have a lot to contend with, and I'm just encouraging everyone out there to exercise wisdom as well as abundance of caution, and make sure that you're washing your face and washing your hands. You're wearing a mask, and you're properly physically distancing yourselves. This is
Yeah.
going to be key. And Gigi, if you would have any closing words, our time is getting near and it's almost up.
Yeah.
Please talk to the people and tell them what we need to do to make it through.
Well, I think that we're at a critical period of time and change in our society. I think things are bad. I think maybe even things are going to get a little worse. But I also believe that these are labor pains. That there is something change is coming, and but we need to be part of that change. I
Mm,
believe that health equity and good health for the most vulnerable means good health for everybody. I believe that good health has to do with economic and social justice. And I think that if we look at things from that holistic lens, instead of saying, this is happening over here, there's economic
right.
injustice here, there's health injustice here, there's criminal injustice here, whatever. Instead, we have to look at everything really being interdependent. What I think is that we as individuals, as family members, and as members of societies and community, really have to think about what it is that we will be doing. And it could be big or small, because remember, small changes can result in big changes. So whether that is we are going to plant some, herbs or tomatoes at our, in just a little windowsill, and planting food for ourselves. Whether that is, look, I know that the school has been closed and somebody needs some tutoring, because I'm very worried about the education of children, especially in Ward 7 and 8. And, you and
Absolutely.
I, Pastor, have spoken about the great digital divide, and we've really made a very strong recommendation to the mayor to get free Wi-Fi for everybody, both for the education and for the medical. But I think it is that we have to start thinking differently. We are not individuals. We are all connected. All of us are connected. And, we have to really begin to practice the golden rule, or said a different way, which I love Curtis Mayfield. And he has a song that says, if there's a hell below, we're all going to go. So we got to get
That's
ourselves together.
right.
And we really have to do better, because as you said, it's not just us, it's generations to come.
That's right.
And there is no reason in the richest country in the world that everybody can't be fed, that no child goes to sleep without having food in their bellies, where people can't be housed to be educated, all of these things. But I think it's going to take us during this difficult time to reflect about what each of us is going to do, and to recommit ourselves to social justice at the end of the day, right?
Yeah.
So those are my closing words.
And thank you so much. I'm so grateful for you and your sharing and your help and really the belief in the vision um, that we have for the Pennsylvania Avenue Baptist Church, which this is really coming to pass. Um, I just hope that folk are hearing. I do want to take um, one last question or one last comment. It says because so many won't, I guess, won't wear masks. I think if we tell people masks protect them because we don't know who has the virus, maybe the whole idea of masks can catch on. And I understand what the panelists is very. It's a real phenomenon.
Yes.
There are so many folk that say, you know what, they wear their mask and they wear it around their chin. They wear their
Mhm.
mask is hanging off of one ear. It's
Mhm.
not covering their particular nostrils and breath. And then there's a certain mask for you. One mask does not always fit all. So
Exactly.
that's something we have to definitely encourage. But I do encourage everyone to wear a mask because health matters and we want to see you alive. We want to protect your life. That's why we wear a mask. I'm encouraging everyone at Pennsylvania Avenue Baptist in the surrounding community of DuPont Park, Penn Branch, Hillcrest, Randall Highlands, all of those, wear your mask. Um, and we need to go even deeper into the community. All of the neighborhoods of Ward 7 and Ward 8, wear your mask. We need you healthy. We have much work to do. And we can do better to fight against injustice, because anytime we're dealing with injustice locally or anywhere is a threat to justice everywhere. We
Mhm.
have to make sure that we're doing what's necessary. So I thank you, Gigi. I look forward to
Mhm.
much more in terms of collaboration, and we will continue on. I know you're busy and you won't be able to be with us each week, but guess what? Whenever you want to drop by and do what you
Thank
do,
you.
feel free,
Thank
because this is always
thank you.
conversations with Dr.
Thank
Gigi,
you.
and
Thank
we
you so much.
so much, so
And
much.
I want to thank you for the opportunity. I also want to invite everybody on Monday, June 1st at 6 o'clock. Secretary Hillary Clinton will be our guest on our Rodham Institute Impact Speaker Series. And I'm actually going to be asking her a series of questions that have to do with health equity in Black and Brown communities, as well as asking her to weigh in on the recent events. So I hope that people can tune in. And this is, you can go to our website to get the information. We are doing this in conjunction and partnership with blackdoctor.org, which is one of our partners. And so it'll be live streaming through their Facebook as well as our Facebook. So
All right.
thank you. Much love.
Well, much love always.
Thank you.
A-
Thank you.
and
Thank you.
and we just thank you all for joining us today with the Pennsylvania Avenue Baptist Church presents Conversations with Dr. Gigi. I'm moderator Kendrick Curry and pastor of the church, and certainly we have Dr. Jihan Gigi Albayume, and she is just a dynamo
Oh,
in the field of medicine. And thank God for the Rodham Institute, for George Washington University, and all. We just bid you a good night and take care. We're looking forward to something great happening through our conversations. Be well.
bye. Thank
Bye bye.
you. Bye bye.